Grassroots emails and phone calls do work and do have an effect on our legislators. We should also note that Representative Kevin Bailey and Senator Phil Pavlov were opposed to the exchange. Senators Mike Green and Pat Kolbeck were also instrumental in stopping this. So thank you to our legislators for getting this done. Very important. They're doing their job. All right, well, we're to the main event. Our guest speaker tonight is Jack McHugh. He is the Mackinac Center for Public Policy Senior Legislative Analyst and editor of MichiganVotes.org, a unique website that puts the activities of the Michigan legislature at citizens' fingertips, which is really valuable for a group like ours that is a watchdog that wants to know what our legislators are doing. Since the site was launched in 2001, McHugh has written or edited concise, plain English descriptions of every bill, vote, and amendment in the State House and Senate, which can all be searched and sorted on the MichiganVotes.org website. McHugh entered the Michigan political and public policy scene in 1994, spending 6 years as the legislative chief of staff in the House of Representatives. McHugh has a bachelor's degree from the University of Michigan and a master's degree in political science from Central Michigan University. Jack's essays on public policy issues have appeared in the Detroit News, the Detroit Free Press, the Oakland Press, the Grand Rapids Press, and many other newspapers. Please join me in welcoming Mr. Jack McHugh.
Yes, I'm Jack McHugh, Mackinac Center. Mackinac Center, this is our 25th year. Is everyone here? Well, are you familiar with the Mackinac Center? How many here get our Capital Confidential email every day? I should have brought a sign-up sheet, and I couldn't find any of my clipboard, so I didn't. But I'm going to strongly urge everyone to go to Mackinac.org and sign up for the daily email from Capital Confidential. That's our online news publication. And I'll tell you what the email is. It's 2 sentences, a headline in 1 sentence, a headline in 1 sentence, because we have 2 fresh new news stories every day about stuff that's going on, almost all of it here in Michigan. Things that the mainstream media doesn't want you to know about. So if you want to stick it to the MSM, get CapCon every day. And if you want to, make the MSM feel good about how they're stifling true debate in this country, then don't. So I'll leave it at that. As I say, Mackinac Center is our 25th year. During that time, we have been the uncompromised voice of limited government, smaller government, free market solutions to our state's problems and challenges. We have never accepted any government money. We've never been offered any government money. We've accepted if it was offered, which, as you're about to hear, isn't very likely anyway. So what I'm here to talk about is possibly the most important issue that our state legislature will face. And I know that this Tea Party, many Tea Parties, talk a lot about national issues, federal issues. It's not often that state legislatures have an opportunity to really push back in an effective way on a huge matter of federal overreach. And the Obamacare Medicaid expansion is one of those opportunities. This, in a way, is kind of exciting because I have to tell you, grassroots individuals and groups have very little ability to impact the actions of Congress and the U.S. government. Every now and then we can whip up a mob and make a difference on a particular issue. But for the most part, you guys call Congressman or Senator Levin or Stabenow, whatever. kind of worthless exercise that is most of the time, not always, but most of the time. In contrast, we, and as individuals and as groups, have tremendous impact on the actions of legislators and our legislature. And I'll give you an example. The introduction said I served 6 years as a chief of staff in the Michigan House of Representatives. And if a legislator got 6 or 7 or 10 or 12 emails or phone calls or letters about a particular issue from real people, not ginned up, special interest postcards or something like that, it would change votes. That you would have a legislator who would go into the caucus meeting before the daily session, say, guys, I'm sorry, but they're contacting my office. He may have gotten half a dozen calls, and what he might say is, I've got 15, 20 calls, and I'm just not going to be able to go along with the caucus on this one. And let me quickly describe what happens when you call, when you contact your legislator. First of all, the only ones who care what you think are the ones that represent you. You call someone from another district, and this applies at the national level too. The politicians only care what the people in their own district think. They honestly couldn't care less what anyone outside the district thinks. So when you call a legislator, first thing the staffer will do is ask your name and address. And while you're talking, he's looking you up on a database, and up will pop, and assuming that if he is your legislator, he or she is your state representative or senator, if he's not, they will pass you on to they'll give you the right number and the right name and just shuffle you along. But if you are talking to the right person, they have the screen, and it will show, and it will bring up your name and your voting history. And it will show every election that you voted in the last dozen years or so. Not how you voted, obviously. We still have secret ballots. But whether you voted. And here's what they're looking for. Is this person, first of all, does this person vote? Did they vote only in general elections in November? And if that's the case, I'll speak from my own experience. If someone called and they're purely a general election voter, I would be polite. I'm a Midwesterner, I can't help it. But I'm not going to bend over backwards for that person. However, if I see that person every 2 years votes in the August primary, here's how that conversation goes. Mr. Jones, what can I do for you today? Would you like to speak to the representative directly? I can put you through to the floor. It's that stark. I mean, it's not necessarily every time you're going to talk to the representative. But if you're a primary voter, that's what they really care about. Because guess what? Almost all the elections that matter in Michigan don't take place in November. They take place in August. Most state legislators, most Congress members are chosen in the August primary, not the November general election. Because most districts are predominantly Republican or Democrats. Some of that is gerrymandering, playing games with the districting. But a lot of it is just geographic reality. If you're, for example, if you're in Kent County or on the west side, Grand Rapids, outside of Grand Rapids, you're going to have a hard time creating a Democratic district. If you're in Detroit, you're going to have an impossible time creating a Republican district. So it's just the nature of the beast that the elections that really matter are the one of the primaries between candidates of whatever the dominant party in that district is. So I just wanted to share that with you because, again, we have an issue on the table here that is a decision that our legislature will make that has a very critical impact on what is, I'm sure everyone in this room agrees, one of the most destructive public laws ever passed in this country, which is Obamacare. Obamacare is vulnerable. If it has a number of challenges going forward. Some of these are operational. The so-called exchanges, which styled as exchanges. Let me tell you what these things really are. They are departments of Obamacare Subsidy Administration. And the vote that was referenced about a so-called partnership exchange that just took place in the House and Senate. I have to tell you, that's kind of small potatoes compared to what I'm going to talk about tonight, the Medicaid expansion. There was a very important exchange battle that took place in this state. It took place in 2011, 2012, and we won. It's over. Our side won, and the battle was this. It was one of two opportunities that states had to push back in a very significant way against Obamacare. Whether or not to create a state department of Obamacare Subsidy Administration, aka the exchange, or whether to say to the feds, hey, you do it, Pottery Barn rules, you break it, you own it, you do it. We made that decision last year. Our legislators, kind of by default, by not voting to do the wrong thing, did the right thing, which was to say to the feds, you run the exchange. This vote that just took place was frankly on more of a window dressing kind of issue, the so-called partnership exchange. The partnership exchange is a federal exchange in which the state would essentially run the help center, the call center. The state would be the secretary who takes the calls, basically, while the federal government is doing the dirty work, matching up the IRS data, the insurance data, the Medicaid data for every individual to determine whether that individual is eligible for Obamacare insurance subsidies and how much they get. And that's a big, dirty job that is going to be very intrusive. They just came out with the draft of the application for that. It's 20 pages long. It's got like 60 pages of instructions. This is like, some IRS tax form nightmare situation. And people that have, looked at it said, you know what, given what they're trying to do, it's hard to make it any simpler than what they have. But, so anyway, that was the first of two opportunities that the state has pushed back. And we did the right thing. This matters for reasons that maybe I'll get into later. I want to get sidetracked from the Medicaid expansion, which is the decision that's on the table right now. Obamacare stands on two foundational things. One is the individual mandate that the Supreme Court, Justice Roberts, helpfully rewrote the law to in a way that would allow them to uphold that, which if anyone had any doubt that the Supreme Court rulings are at root fundamentally political, that should have eliminated that doubt. But I don't want to get sidetracked into that either. The other foundational support is the Medicaid expansion. And so these were from the start were the two, from the start the individual mandate, if that was not upheld, then the whole logic of the law collapses. And again, I don't want to get down in the weeds too much because we'll get me off subject. But the Medicaid expansion, the Supreme Court ruling did two things. It upheld the individual mandate, but as passed, the law forced states to expand Medicaid, the health care program created by LBJ in 1965 for healthcare to reimburse healthcare providers, doctors, hospitals for services they provide to poor people. The law is passed mandated that states must expand that from covering adults, families up to 100% of the income the federal poverty level, to covering families up to 138% of the poverty level, 138%, and then also covering childless adults who are below 100%, from 0 to 138% basically, who are not covered under the current Medicaid. And the Supreme Court, in the same ruling as that I'll call the individual mandate, said that the feds can't jam that down the state's throats. They made it optional. Well, this kind of pulled one of the logical underpinnings of Obamacare out. You recall the law only barely passed, and there was a whole lot of compromises on all kinds of different matters, some of which were kind of dirty, like Cornhusker kickback and things like that, and some were legitimate public policy disputes, like, hey, this thing's going to bankrupt the country. We have to do things to make it cost less. One of them was to cover part of the people at the lower income levels under Medicaid rather than under the exchange, which is basically a private health insurance policy with a big fat government subsidy and a whole bunch of new mandates on those policies that's going to make them way more expensive than they are now. So these are those two things are the two structural vulnerabilities in the law. Other vulnerabilities are, I just mentioned one, the sticker shock that's going to hit next October and starting next October and really coming home next January 1 when the whole thing kicks in completely. What the law does is it mandates that every insurance policy, health insurance policy in the country, the ones that you are mandated under the individual mandate to own, have two features, universal access and community rating. And what this means is that you can wait till you get sick to buy insurance, and they got to sell it to you. This is like telling home insurance that you don't have to buy the insurance ahead of the fire. You can wait till your house is on fire and call the insurance company and say, okay, I'm signing up now. And they got to sell it to you. Not only do they have to sell it to you, they can't charge you very much more for it. There's price controls, price bands that limit how much more they can charge. Well, when you impose these absurd mandates on insurance, it jacks the price up well beyond what we have become accustomed to, which is already pretty doggone high. And in fact, it totally doesn't work. It's totally an impossible situation for the insurance companies unless you have the individual mandate. Unless you have the government forcing everyone to buy the insurance, then the rational choice is to, well, I'll just wait till I get sick and go in and buy it then. So that's the purpose of the individual mandate. But I mentioned the political compromises that were involved, the back and forth in passing this thing. The individual mandate, guess what? It's way too low to force us to buy insurance. It's the same thing with the employer mandate that forces every job provider with more than 50 employees to provide insurance, or they have to pay a $2,000 penalty. Well, guess what? If you're an employer and the cost of an insurance policy for each employee is $7,000, $8,000, $12,000, or you could pay a $2,000 penalty and just skip it. A lot of them are going to do that. So in the same way with the individual mandate, it kind of makes sense to not buy the insurance and just pay the penalty. So again, and the reason I get into that is getting back to the two logical foundational underpinnings of Obamacare, the individual mandate and the Medicaid expansion. All right, let me get into the nitty-gritty of the Medicaid expansion and the decision that our legislature is facing right now. That, as I say, is a lot more important than that partnership exchange appropriation bill that was recently defeated. as I said, the law originally mandated, now invites states to increase their Medicaid coverage from 100% of the poverty level to 138%, and to include all childless adults in that range from 0 to 138. This is very expensive for states, and so to create an incentive for the states to do it, the Fed said under the law, we will pay 100% of the cost of the expansion for the first 3 years. And then after that, the state gradually takes on a little bit more each year until it tops out at 10%. The state would be responsible for 10% in 2020 and forevermore. This is being treated in the legislature as if it's an arithmetic problem, a simple arithmetic problem in which all the terms are known, and all you have to do is do the addition, do the multiplication, and out comes the answer. And here are those terms. The bureaucrats in the Department of Community Health estimate that 470,000 more people will sign up for Medicaid under the expansion than would otherwise. They plug in an average cost for each one of those individuals, and they then calculate, if Michigan's responsible for 10% of the cost starting in 2020, how much the state would be on the hook for, cost-wise, how much our state taxpayers would be on the hook for directly, or to put it, to be more precise, how much of the cost would be on the Michigan state budget instead of on the federal budget? Because last I looked, Michigan taxpayers were also federal taxpayers, but so it's useful to be precise about the language. And in one sense, all of us, well, wait a second, I'm federal and state, I'm going to get it either way, right? But for state legislators who are trying to craft state budgets, this is a really big deal. And frankly, as state taxpayers, it kind of matters to us also, even though we are also federal taxpayers. So 470,000 people times X dollars per person. The feds pick up 90%, the state picks up 10%. And starting in 2020, the answer is that it would cost the state of Michigan about $300 million more every year from then on the state budget. Because back up stuff. Medicaid is a complicated program in which it's a state-federal partnership. Right now, the feds pick up a little over 60% of the cost of Michigan Medicaid, and the state's responsible for the balance, about 43%, something like that. Somewhere in the high 30s. So under the expansion, again, the expanded population, Michigan would be responsible for 10% of the cost starting in 2020. It comes to $300 million a year, if those numbers are right. And this is what I mean about the arithmetic problem. What if it's more than 470,000 people? Or what if the feds renege on that 90% copay? That they'll pick up 90% of the cost, the expansion cost. If either one of those things happen, then the cost could be a lot higher to the Michigan state budget. So instead of $300 million, maybe $4, maybe $5, maybe a lot more than that. And we have good reason to be suspicious of these numbers that are being thrown around. So the 470,000 people, it could be there is past experience in other states that did expand their Medicaid programs before Obamacare that suggests that the estimate of 470,000 is way low. I'll cite two. In Arizona, they decided to use some free money from the tobacco lawsuit shakedown of the late 90s to expand Medicaid. And they had projections of how many people in these different populations, families and childless adults. And the projections were like 1/3 of the number that actually signed up for the thing. And their cost estimates, the costs were actually 4 times higher than what was anticipated. So, I mean, it wasn't even close. And I'll just say this about the source of these numbers. I mentioned it's bureaucrats in the Department of Community Health, in combination with other experts, are the source of these numbers. Well, guess what? These bureaucrats, their self-interest is greatly served if Michigan does the expansion. They'll be part of a much bigger, more important, more expensive program with a lot more money flowing through the department. So, when you look at the incentives of the people who are making the current estimates, kind of compare them with what happened in Arizona. Maine is another state that expanded its Medicaid program in the 2000s, had a similar kind of experience. The costs and the number of people who were way beyond what was projected. And you look at who's coming up with projections and what the incentives on them is, and it's like, well, yeah, I mean, it's not that surprising that they were lowballing the estimates in advance. So, back to the arithmetic problem, maybe it'll be 470,000, but you know what? Don't be surprised if it's a lot more than that. Maybe the feds will pay 90% of the cost, but you know what? Don't be surprised if they don't. That's not pure speculation. President Obama has already proposed cutting the reimbursement rates. He did so as part of his last 2 federal budget recommendations. And I know those budgets were, dead on arrival. The last time the Senate voted on one of them, before this month, about 4 years ago or 3 years ago, whatever it was, it only got 3 votes, I think. But here's the point. Trimming that reimbursement, that federal share, sticking more of the cost to the states, is already in the administration's budget-cutting playbook. So the chances that that the feds will pick up the 90%, as I said, it's being treated, this issue's being treated like an arithmetic problem in which all the terms are known. Those terms are subject to are the product of assumptions that are really shaky assumptions. So so I mentioned in 2020, assuming the assumptions are right, the state will be on the hook for $300 million more. Well, why in the world would legislators feel like they even want to get on board this thing now? Well, as I said, the feds will pick up 100% of the cost of the expansion for the first 3 years. And what that will allow state politicians to do is to shift some current spending that's on the state budget to the federal budget. And we're talking about $200 million a year. This is primarily mental health spending for indigent childless adults that the state provides right now, mental health services. And frankly, this is spending that no one really disagrees with. I mean, it's in our state constitution that the state provide mental health services to people that need it. And this is, we're talking the guys in the park that talk to themselves, okay, and providing some mental health services to these people. It's something that arguably it is a core function of government. It's just a cosmic injustice that gets inflicted on some people. And as I said, the state spends about $200 million on this right now. We'll be able to shuffle about $150 million of that, plus some other spending. It comes to about $200 million all told, from the state budget to the federal budget, which means that Lansing politicians are looking at $200 million in next year's budget that they'll be able to spend on something else. Or, God forbid, maybe even get a tax cut. Well, no, we don't have that. But they'll be able to spend, maybe roads. Who knows what. More like the corporate welfare, but either way, it's very attractive to these Lansing politicians. It's very tempting. And I don't want to be too cynical about this, but, you know, Michigan has some pretty tough term limits, and most of these guys are looking at 2020. I'm not going to be in office then. Won't be my problem. I'm concerned about next year and $200 million. Boy, there's things we could do with that money, and probably the year after, and the year after that too. Now, as I say, I don't want to be too cynical. I think most of them, I don't think many of them are being that crass about it, although I'm sure there's a few that are. So this is why this calculation is why Governor Snyder, who has not been good on Obamacare from the start, he promoted the state exchange, making the state in charge of administering Obamacare subsidies. He lost on that, and he's pushing hard for this Medicaid expansion because he's just doing the simple arithmetic, assuming the assumptions are valid, even though there's good reason to think that they're not. You know, running the numbers and saying, well, that's in nerdy fashion, that's positive for Michigan, more federal money coming in. And however, to his credit, the governor recognizes that the savings are short-term only, that, you know, when the full cost and the state's full share kicks in 2020, we'll be on the hook for about $300 million more. So what he wants to do is take half the amount of the savings between now and then, which comes to, I forget the number, $800 million, close to $1 billion between now and 2020. Take half the amount and put it in a lockbox, and then use that to cover the extra expenses down the road. Now, we know what happens with government lockboxes, right? But let's pretend that this time it's good, and that they really don't raise that fund. It would be unprecedented, but let's give the benefit of the doubt in this instance. Even if they do, yeah, okay, and under the governor's calculations, if all those assumptions are legit, then, you know, that'll cover all the expenses for the next 18 years or something like that. Well, even if they don't raise the piggy bank, it's still a pipe dream, as those previous expansions show, as the evidence that the administration is going to cut is going to increase the state's share. And by the way, I've heard that the federal government is kind of short on money these days too, and it's going to get less so in the coming years. So I mean, the chances that these promises of 90% reimbursement from the feds actually come true are just pipe dreams. I mean, we all know this. You know, we don't have to be. We're allowed to be realistic about what's likely to happen. Well, okay, what if Michigan doesn't go along with the expansion? What happens to those people between 100% and 138% of the poverty level who would have been covered by the expansion but aren't? Well, they would be eligible for a real private sector health insurance that they'll get through the exchange. The feds will be running in this state, which is a lot more valuable than lousy Medicaid. Medicaid's a broken program. The state's chronically low reimbursements to hospitals and to physicians. The reimbursement rate for primary care physicians in Michigan is about half of what private real health insurance pays to primary care physicians. For hospitals, the nationwide reimbursement for hospitals is about 80% of their actual costs. And yet, what they say their actual costs are, there actually are no prices in healthcare. So what the hospitals say their costs are is kind of a figment of political imagination. But it is a fact that the hospitals get a lot less from Medicaid than they get from private insurance companies for the same services. And so all those people, and what that means, because the providers are so low in their reimbursements, it's hard to find a physician that will accept new Medicaid patients. Michigan, actually, surprisingly, about 80%, reportedly, about 80% of physicians do accept new Medicaid patients. Frankly, I'm skeptical about that number because in most states it's more like, it's about a third don't. It's the number. I mean, the trend is very much in the direction of more and more physicians saying, just not gonna, can't afford it, not gonna do it, take any new Medicaid patients. So, if we do the expansion, we're kind of condemning the people in that range to a broken program. The health outcomes of people on Medicaid are worse. Their survival rates after surgery are worse than those who have private insurance. And there's a lot of complicated reasons for that have to do with demographics and whatnot, just the nature of the populations being covered. But part of it is because it's hard to find a doctor. If you're on Medicaid, they tend to wait longer to get checkups or to get tests and whatnot. People that depend on Medicaid, they tend to use emergency rooms a lot more than people on with private health insurance. So if we do the expansion, that population will go on crappy Medicaid. And if we don't, most of them will be eligible for subsidies for subsidized real life insurance policies that sold through the exchange. These individuals would have to pay some 2% of their household income for individual. Get the exact number. It comes to like a couple $100 per person. And frankly, the state could do better in terms of if the goal is to shift spending from the state budget to the federal budget. We do better to just pay those amounts, to subsidize the share, the individual share of how much they have to pay for the insurance on the exchange. Well, there's kind of a trap in what I just have been describing, that these individuals would go and families would go onto the exchange. I mentioned, and I think you've heard, that the United States has a little budget problem, deficit problem, debt problem, etc. Spending government is going to be subsidized insurance through the exchange. Actual government spending may go up under that option. The whole global state and federal budgets all combined. So why wouldn't the Mackinac Center want to do the expansion? If it could possibly save some money under Obamacare. And the answer to that question, I have to kind of step back and do the thing that, frankly, Governor Snyder has not been good at, which is to look at the big picture. And that big picture is one that you are all very familiar with. Obamacare is probably the most destructive law ever passed by the United States Congress. It will make us less free, less prosperous, and less healthy. This is a bad law. And it is the duty of policymakers at all levels to push back. It is especially the duty of policymakers at the state level push back, because in addition to those bad things that I just listed, Obamacare is also a massive usurpation of the principles of federalism that are baked into our constitutional system. So state politicians have a duty to push back, and I don't care if they are liberal or conservative, Democrat or Republican. Vermont's legislature is about as socialist as they come. They're about to pass a law, Canadian healthcare law, that bans the private practice of medicine in Vermont. And yet, even Vermont legislators should push back against the usurpation of federalism. I started by saying Obamacare is still vulnerable. And one of its core vulnerabilities is the Medicaid expansion. We want this law, well, what we really want is for it to be repealed. Short of repeal, we want it to be opened up and some of the worst things either removed or made less bad. And when I say the law is vulnerable, that's kind of what I mean, is it is vulnerable to this president and this U.S. Senate actually having to say, you know what, we have to make some changes. Which right now, it seems like that will never happen. But I got to tell you, starting this law will start wreaking havoc on individual lives, starting less than 9 months from today. Or actually, exactly 9 months from yesterday, January 1st, 2014, when it fully kicks in. It is already creating huge havoc in the insurance market and the healthcare delivery market systems, and it's going to start imposing that havoc on individual lives. The chances that these exchanges will open and be able to start delivering these subsidies as advertised, I think are zilch. I mean, I think the bureaucrats that are trying to put this thing together are so far underwater, they can't even see the surface. Well, this is the most complex information technology project ever undertaken, probably anywhere, anytime, for anything. I mean, this makes the moonshot look like a child's play. And we all know that government IT projects are always low budget and ahead of schedule, right? No, that's not the way it works. So the chances this thing's even going to get off the ground, I mean, it may explode on the launching pad spectacularly. Or they may bolt through in various ways and inflict a lot of havoc on individual lives. So it's very possible that 9 months from now, you'll have a supermajority of the U.S. Senate and the U.S. House demanding that the law be reopened and adjusted. So that's kind of the end game that we have in mind. That's why it matters for Michigan's legislature to say, to push back wherever it can. The exchange was the first opportunity, did the right thing there. This is the second one. It matters. It matters for the future of the law and for the future of our country. So I guess I will leave it at that. I know, I'm sorry, it's complicated stuff. The exchange was easier. It was no state exchange. It was real simple. This is more complicated stuff, but it's really important. It really matters. And it's, back to where I started, that your ability to impact the votes of legislators is probably much higher than you imagine it to be. Now, I know you've got some pretty decent lawmakers that represent you here. Pavlov and Mike Green and Daley I'm less familiar with, but apparently he's not too bad. I got to tell you, these guys are getting lobbied intensely by the healthcare industry and by all the welfare establishment and welfare advocacy organizations and whatnot. And they got these people in their offices every day. And plus, they're looking at $200 million to spend on something else, or $100 million if we put half of the Blackhawks. So they've got, the incentives for these guys to do the wrong thing from the Tea Party point of view are very, very strong. And yet, your ability to get the right answer from them is is probably much higher than you think. So I'll leave it at that, and there's, I don't know if there's time for questions, but thank you.
Anyone has, I had about 30 questions, but is there anybody that has a question? We have Tim Liz is up here with the microphone. You can just come right up, say your name, and ask your question, and we'll try to give quick questions and quick answers and get through a few real quick. And I have a microphone that's cordless, so I can come right back here and have this great gentleman ask his question.
Well, I really haven't heard anything about Medicare. What they're going to do with Medicare right now, which I have Medicare and Blue Cross supplement, and I was wondering if there's any input. I hear about a lot of other things, but I haven't really heard that mentioned.
Well, they're on track to cut it. They're cutting the Medicare Advantage, very popular plan, less than was feared they might. Supposedly it's going to get a big cut before next year, although there's a real good chance that Congress will reverse that, because when I think about older people on Medicare is that they tend to vote and they scare the heck out of the thought of making millions of them real mad. Scares the heck out of politicians. But Paul Ryan was right during the presidential campaign and Romney when they explained that, hey, we're not proposing cutting Medicare. Congress already voted to do it, and the president signed the bill. It's all in Obamacare, which, on the one hand, frankly, that's something that needs to happen. It should happen in a smart way, the kind of way that Paul Ryan has proposed, which would be a premium support. It would, start re-injecting some more virtuous incentives, private sector-like incentives into the system, rather than just the brute force command and control way that they use for Medicaid, which is healthcare providers, we're only going to give you 50 cents on the dollar, take it or leave it, suck it up and shut up. Basically, is the method that is in law right now, but we'll see. The state legislature, it's totally outside of the purview of what's on the table in Lansing right now. So that's one for the feds to deal with, not for our state.
I have a question on community. I used to work in community health, and the supervisors there, their budgets always worked like, okay, we have this much time till the end of the year, we have to spend this much money, or we're not going to get it next year. Is that still probably continuing on with all of? How does that play into all those?
Sure. That's a perennial. That's one of these pernicious incentives of big government, just the political incentives. Let me say something. I mentioned that the population, the childless adults under 100% of poverty level are not covered by Medicaid. Michigan spends, it's about $175 million from the Michigan budget for mental health care services for that population. And one of the downsides of the expansion is that Medicaid, the federal government, the bureaucrats in Washington, exercise very heavy-handed control over this program, what states can and cannot do. And what happens under Medicaid is a constant stream of mother may I requests from state bureaucrats and state agencies to the feds to make adjustments. And more often than not, the answer is no, you may not. Well, Michigan is considered to have a fairly decent community mental health care system. The people in the system think that they're doing a pretty good job, and compared to many other states, reportedly they are doing a pretty good job. Now, there's no, pretty good is a relative term. This is a problem, a human, societal, individual problem that is just old as time and will never go away. You can never fix completely. But comparatively speaking, we do a pretty good job in part because we're not under the federal bureaucrat's thumb, because it's not covered by Medicaid. That's become part of the tab. And so one of the discussions that's underway, and Nancy related all this, is, hey, we don't want to do the expansion, because then we will be playing this mother may our pretty good system may get compromised. And to the extent that we would like to extend some physical health care, not just mental health, but physical stuff to these populations, there are some ideas floating around that would not cost a ton of money, that would allow the state to provide a better package of benefits and maintain control of our own ship going forward. So, this is, there's, when I talk about, we shouldn't do the expansion to extend Medicaid to cover people under 100%, childless adults under 100% population, there's a legitimate argument on the compassion side for doing that, but because those people don't have coverage right now. But on the other hand, the response to that is, you know what? Medicaid is a broken program. So why, if you really do want to provide more, healthcare services to those people, there's ways to do it. There's ideas for how to do that are affordable and sustainable, and that won't put the state in the position of playing Mother May for the next 40 years over the coverage we provide to that population.
Do you have a for instance of what they can do that's better?
No, I can't. I mean, I have to dig in. I'm not an expert on that system. I'm reporting what I've heard. That's why I was kind of careful the way I say it. I just said, they think they're doing a pretty good job. They're considered, compared to other states, to be doing a pretty good job. I could come up with examples of states. Well, actually, I'll give you one on a Mother May. It's not Michigan Mental Health. Connecticut, True Blue, Connecticut, had a program. They did one of these expansions of Medicaid to cover younger people, a lot of college people. And I forget the details. It was in the news a couple weeks ago. And it just, as always happens with these expansions, the cost just skyrocketed way beyond. This was an optional coverage that the state had undertaken. And yet once it was undertaken, they needed federal permission to make some adjustments to it to get the costs under control. And it was in the news a couple of weeks ago because the feds, they asked Mother May last summer. The mother came back 2 weeks ago and said, no, you may not. This is an optional expansion. It's not even mandated on the federal Medicaid law. So there, that was a very heavy-handed, or very stark example of federal heavy-handedness in this Mother May game.
Yes, Jack, thanks for being here tonight. We really appreciate it. One of the things that we always try to do here is we always try to put it kind of like the simplest terms. We ask our members that are real good at emailing and calling and talking to our legislators. Can you give maybe 3 or 4 main bullet points that when we're talking to, whether it's our legislators, whether it's our friends, neighbors, or maybe it's just some bullet points that we can kind of hit to get a conversation going, get somebody thinking, about this.
I think the best approach to that is what I finished with, which is the principles of the thing. That this Obamacare will make us less free, less prosperous, less healthy. You know what, Mr. Legislator? Maybe all those special interests are right. That it'll bring more money into the state, that the numbers won't be out of sight, that the feds actually will keep the promise of 90%. Maybe all that would happen. But you know what? You should still oppose it. Because this law is bad for our country. And this Medicaid expansion is one of the law's vulnerabilities. You've got a majority of states now are either on the fence or have said they're not going to do it. You've got at least 30 states, I believe, it's a little more than that have said we're not going to do the state exchange. We're going to let the feds run that. This is one of the two things. Thank you, Mr. Legislator, for doing the right thing on not creating a state exchange. Thank you in advance for doing the right thing on not roping Michigan into the Medicaid expansion. Because you know what? Even if some miracle happened, all the numbers worked out, it's still the wrong thing to do for the reasons I said about the big picture stuff, federalism, usurpation, etc. And you know, the problem with politicians is that they all think that they can talk anyone into anything. And you know, if you get one of them from in here, I'm sure you've done this before, there's this huge knowledge asymmetry. They know a lot more about these programs than anyone in this room does. Because they live this stuff every day. They hear, you know, the people that actually run the programs, the committee testimonies drawn on for hours at a time. They really know their stuff on this. So if you get into an argument with them or a discussion with them about the numbers, they can dance around you in ways that you can't keep up, whether they're right or wrong. And frequently, you know, there's a lot of spin, but you don't know the difference. When you hit them with, you know what, this law is wrong, and it's wrong for our country, and it's wrong to collaborate with its implementation in this state, they don't really have any response to that, except, yes, sir.
Okay. Well, with that, we're going to wrap things up. Thank you, Mr. Hughes. We've gotten an education this evening. We're glad that you guys have